So, hi everyone. I'd just like to thank you all for coming along and for the opportunity to talk to you today. And a big thank you to UOW's conference team for putting together such a successful event for rural healthcare. My name's Kate Hurst, and my current research project is exploring the impact of crisis funding on the wellbeing and health workforce capability of rural clinicians and their communities through natural disasters and emergencies. So to tell you just a little bit about me, I'm 24 years old and I'm a born and bred Wagga girl. After growing up and doing all of my schooling there, I moved away to study a Bachelor of Pre-Medicine Science and Health at UOW. And off the back of that, then went off to Sydney to start my Doctor of Medicine at the University of Notre Dame. I'm now about to complete my final year down in Wagga, and I'm collaborating with the Rural Doctors Network to complete this research as part of my MD project. I've got a really strong passion for rural medicine, and it's always been a goal of mine to return to the country and start my career as an aspiring orthopaedic surgeon. Don't judge me, sorry. So this research project hits really close to home for me. After witnessing the devastating impacts of the droughts, the bushfires and the floods over the years, I feel really honoured to have the opportunity under the RDN's embedded research program to contribute to providing support for our rural practitioners who've got a massive role to play in these disasters. Given the current climate, this research is incredibly relevant. We know that our rural clinicians need our support now more than ever, and being able to understand where the support is needed and what gaps have to be filled is the key to providing successful support. And it also enables me to pursue my passions to contribute to the betterment of rural healthcare. When investigating where this project fit into the scheme of things, there was a massive gap found in current research to explore the impact of recovery funding on the mental health of rural clinicians and their practices. We acknowledge that funding is only one part of a system-wide approach, but it's an important building block that we wanted to explore and target. In thinking about how mental health is being affected in the current climate, research has found that Australian healthcare workers showed significant symptoms of depression, anxiety and PTSD due to the implications of COVID-19, which was mirrored in multiple international studies. Additionally, the Australian National COVID-19 Primary Care Response developed by the Australian Government Department of Health lacked a response to the mental health care of practitioners beyond administrative measures put in place to minimise stress. In the context of natural disasters, previous studies have found that extensive river flooding in rural Australia leads to an increase in PTSD rates, which was reiterated by the historic correlation of the Ash Wednesday bushfires with PTSD in first responders, including GPs who are the gatekeepers to mental health services for their communities. By their nature, natural disasters increase morbidity and mortality in affected communities, which places an increased burden on the healthcare system, and these stresses are seen to take massive tolls on our clinicians. While some foundational research exists on the topic, globally there's a lack of research that has investigated the implications of recovery funding for rural practitioners after natural disasters. Furthermore, no primary data had been obtained on the implications of bushfires on the well-being of these clinicians, and hence this study aimed to fill the gap that is incredibly relevant given the cumulative events of 2019 to 2022. The research itself focused on a specific grants project that was orchestrated by the RDN. In 2020, funding of up to $10,000 was provided to 20 rural practices that were adversely impacted by bushfire and drought. This funding was for the implementation of wellbeing activities within the practice, as well as activities that promoted sustainability and workforce capability. The study aimed to assess the implications of recovery funding during COVID-19 and natural disasters on the wellbeing and workforce capability of rural practitioners. Furthermore, it aimed to identify the gaps in current research and support to address the needs of health professionals during these times and draw on recommendations for the betterment of future projects and recovery support. Stage 1 of the project involved an online survey that was emailed to the practice managers of the 20 grant recipients to determine the effectiveness of the funding and the impact on their wellbeing, resilience and workforce capability. The questions related to how the funding was utilised for learning, community benefit, recovery and development, and future ideas and implementation. These questions were directed at understanding both the impact of the natural disasters on the practitioner and practice staff and the support they feel was warranted during these times and into the future. Descriptive statistics were used to explore the survey results to determine the effectiveness of and satisfaction with the funding program, as well as the impact it had on professional and community wellbeing and health workforce capability. This data then informed Stage 2, which provided an opportunity for elaboration. Stage 2 involved a semi-structured interview centred around the clinician's background, how they used the funding, how they felt the funding assisted them with their workforce capability, their resilience and their well-being, as well as their impact on other issues such as their COVID-19 response. It also provided an opportunity for recommendations on the future improvement of the grants program, and thematic analyses were used to explore the qualitative semi-structured interviews, which was supported by the descriptive statistics from stage 1. So at this stage of the project, all of our data from stage 1 and 2 has been collected and themed. The write-up is in its final stages, and we're exploring our options for publication. In looking at our study cohort, our 12 survey participants were from a variety of healthcare backgrounds and included a number of GPs and practice managers, along with a chiropractor, exercise physiologist, practice nurse, and workforce support manager. The survey results were built on in stage 2 with 8 semi-structured interviews. These again included the staff from a variety of backgrounds, with 5 female and 3 male participants, including a GP, exercise physiologist, chiropractor, practice nurse, and multiple practice managers. These participants had an average of 12.5 years experience working rurally and came from practices that range from 4 to 31 staff from all over rural New South Wales. In terms of our results, 6 key themes emerged from analysis. 1, the disaster's impact on the well-being of rural communities. 2, the disaster's impact on the role of the practice and therapeutic relationships. 3, the funding's impact on access to professional development. 4, the impact of training on staff well-being and resilience. 5, the funding's impact on health practitioner capability. And 6, recommendations for future improvements. When looking at the impact of the disasters on the community, it was unquestionable that the cumulative effects of the bushfires, floods, drought, and COVID-19 had a significantly negative impact on affected rural communities. There has been a profound compounding effect with the loss of homes and lives, as well as a multidimensional trauma that exists in much of rural New South Wales off the back of 2019 to 2022. The disasters caused widespread destruction and displacement, which in turn made it difficult for residents to access the healthcare they needed. Even more importantly, every single participant emphasised the psychological impact of the disasters on the patients, with one stating, "The fires we had down here were unbelievable. We lost 430 homes. The technological impact was so life-changing, we didn't have power for a long time. I still see people now, 2 or 3 years down the track, who, if they hear a siren or smell smoke, it brings back all of this anxiety and post-traumatic stress." This is particularly important in highlighting the longevity of the effects of natural disasters and identifying a gap that exists for ongoing disaster and mental health recovery support for these communities. The second theme then explored the way in which the disasters altered both the role of the practice as well as the therapeutic relationships between clinicians and their patients. In talking to the interview participants, it was overwhelmingly evident that for practices that were able to continue operating, almost every aspect of their practice changed, from the support they were providing to the community down to the sheer volume of patients. The personal support as well as the medical care that was provided for patients during this time became a large focus, as many of them had lost livestock and properties during the fire. The participants described themselves as a first point of contact in dealing with the emotional fallout of the disasters and put this down to a lack of dedicated mental health services available elsewhere. One participant even pointed out the safe haven role they played during the disasters, stating there were about 12 kids, 8 adults, 6 dogs, and even more living in the practice for a few nights because the evacuation centre was full. Furthermore, almost every participant spoke to the point of the importance of their long-standing relationship with patients, which facilitated the openness of conversation with patients seeking emotional support. However, the interviews also brought to light the demand that practices were placed under, with an influx of new patients coupled with a loss of resources and staff fatigue. One participant stated, "It really drew a lot of energy out of all of the resources we had. Our staff were fatigued, our doctors were fatigued, and we found that the patients were becoming very demanding." Another interviewee even likened the cumulative disasters to an assault, saying with COVID-19 on top of the bushfires and other natural disasters in the state, it's been such an assault because it puts pressure on our resources and ability to provide support. To add to this, the staff indicated that their own feelings of uncertainty, lack of control, and lack of access to mental health services was an extra kick while they're already down. This emphasised to us the importance of the need to support practices and their staff, who are undoubtedly the vehicles of support for their communities. And it also reiterated the demand for community mental health services and the incredibly broad role that these practices play to ensure the best for their patients. The third theme was centred around the impact that the funding had on the practice's ability to access professional development opportunities. The professional learning undertaken by many practices included mental health first aid and suicide prevention training that without the grant may not have been possible. As one participant stated, "I've been looking at mental health first aid training for years and there's no way I could have afforded it before the grant. We're a completely bulk billing practice. This is the first time since 2000 that we've had access to such in-depth training." Many of the participants also commented that their training gave them better tools to help their patients and brought a greater understanding of their situations and needs, which they said has given us so many more options in terms of client support. Significantly, the training was also said to provide resources that enabled practitioners and staff to manage their own emotions and stress and engage with their peers to debrief appropriately. In one practice, they even adopted a morning ritual to align with each other and prepare for the day. This was really important in facilitating staff wellbeing, as one participant emphasised the burnout that came from the admin team, who were receiving up to 600 phone calls a day. The strategies and team building that the staff experienced due to the assistance of the grant have been long lasting and have helped many of them in their response to COVID and even to the flood crisis more recently. Outside of mental health first aid, other practices utilised the grant to upskill their staff, hire more staff members and expand their services with technology during the pandemic, helping to alleviate the burden on existing staff and provide better support to their clients. The fourth finding we explored was the positive impact that the training had on staff wellbeing and resilience. It was stated that the training, resources and support provided by the grant enabled staff to cope with the demands of their job and better manage the impact of the disasters. This was particularly evident with 63% of the survey participants seeing a significant improvement in staff wellbeing and support, and 44% seeing a significant increase in staff resilience. The participants emphasised the benefits of the grant-funded training in enabling them to identify their own early signs of stress and support and guide their colleagues who were struggling, with one stating that the grant put us in a better situation to handle the emotional demands of the job. Furthermore, the grant was also beneficial in providing a focus for staff as something tangible during a time of uncertainty, and was described as something to work towards when everything else felt like it was being taken away. The second half of these semi-structured interviews focus on workforce capability. Rural health services are under unprecedented pressure due to insufficient health workforce numbers and the distribution of health workforce weighted to urban areas. The RDN has been investigating ways to support and increase the capability of the primary healthcare workforce. Capability in this context refers to skills and experience and the extent to which individuals can adapt to change, generate new knowledge and continue to improve their performance. It is thinking about the intersection between individual capacity and the ability to respond to work considering the whole of rural life challenges, including work, family, schools, partners, education and social life. In talking to the practice managers, practitioners and doctors about what contributes most to their own sense of capability, all 8 participants highlighted professional development as a key factor. Other capability factors included access to education, financial, emotional and practical support, workforce retention, community connection, technology, mentorship, confidence, proximity to family and a healthy workplace, all of which were repeated between multiple interviewees. It was also evident that the support and training accessed with the funding gave them a sense of confidence that put them in a position where they felt more capable than prior to the funding, with average self-capability ratings increasing from 6 to 8 out of 10 after the grant. Significantly, they also felt they were more capable to face natural disasters in the future as a result of the training and skills they acquired through the grant, with one practitioner stating, "It has helped us with our disaster preparedness and our levels of resilience." Finally, the rural practices noted that whilst the grant application process was easy and provided them with a greater sense of confidence, resilience, capability and well-being, there are still quite a few areas for improvement. In particular, additional support is needed for the reimbursement of first aid equipment supplied during disasters, funding for administration and training, support for recruitment and education, training on burnout and stress in the health workforce, and support for other grant application processes. Most strikingly, every single practice identified the need for more mental health services and the upskilling of the nursing team to take away from GP pressures, as well as coordinated whole of government approaches to provide crisis accommodation centres and resources during natural disasters. Overall, the recommendations emphasise the need for ongoing support and resources to facilitate capability and resilience in the rural practices facing these disasters. So these results further highlight the profound effects of natural disasters in rural New South Wales and epitomise the importance of the role of the practices during this time. They also emphasise the importance of not only recovery funding for continuity of service, but the whiplash effect that is felt after emergency funding wanes. Capability is a particular factor that has been identified as vital to supporting recruitment and retention. Funding for training that supports this capability has an incredible potential to support future disaster preparedness for these practitioners and staff members. As this study is the first of its kind in Australia, it has a great potential to be beneficial in informing the New South Wales RDN and other regulatory and support bodies of the implications of crisis funding during COVID-19 and natural disasters on the capability and well-being of rural clinicians, but even more so, the gaps in support that are needed by these professionals to rectify these issues. This should enable improved planning and availability of more directed and effective support services to these individuals in the future based on first-hand feedback from rural clinicians. As the Rural Workforce Agency, the RDN will be using these findings to inform its work, and this has the potential to improve outcomes for the practitioner, patient and healthcare system, as it lays the foundation for future research on different support options that foster the mental wellbeing and capability of our rural practitioners. Indirectly, the exposure of the mental health implications of such disasters in rural areas may also prompt other struggling rural clinicians to seek help and feel less isolated. So I'd like to acknowledge the RDN's Dr. Robin Ramsden and Christine Roach, as well as the University of Notre Dame and Rural Doctors Network for all of their support and guidance during this project. I've popped all of my references at the end of this and I'm happy to give them to anybody that would like them, but I'd like to thank you for coming along and I hope you got as much out of this as I did conducting the research, so thank you. So I think that's a big part of what the RDN's trying to do, and a lot of the feedback we got was that these practices want somebody who puts all of this information when these things happen together and says, here, this is what you need to do, or this is what's available to you. So I think that that's something off the back of this the RDN's taken away, is that they need to really be synthesising all of this information that comes from all the different bodies and giving practices that as like a little support bundle and lobbying on their behalf. A lot of the feedback we got from these doctors and practitioners and practice nurses is that they get all of this stuff and it's great and then it goes and there's nothing. So I guess a part of what the RDN was trying to do too with this is make them do some sort of capability boosting training that helps them to continue to see through after the funding tapered off, but definitely more to be done in the area.